we are in a specific part of our plenary. We have a very interesting presentation on, you remember that I mentioned there are 3 criteria of sustainability, and one of them is quality of human life. Quality of human life. So without quality of human life, we don't need to, you know, if we can save the planet without humans in it, I don't see any point on that. So 3 criteria achieving simultaneously, and one of them it is quality of human life. And here it is a very interesting presentation on how human life can be improved through antioxidative, managing antioxidative stress. Antioxidative stress is in daily life, in molecular level, and in higher level. And this is the dawn of that age. The dawn of that age. Why? Because you can tackle many sicknesses, many diseases by managing the oxidative stress. And this is now exploding as a field. And here I'm very happy to introduce you, Professor Haruhiko Inufusa from Gifu University. He will speak about this. He actually will make a resume on that because it's a full 3 days symposium on oxidative stress. Actually in this room as a specific symposium. So Professor Haruhiko.
Ladies and gentlemen, thank you very much for joining these plenary sessions. I would like to talk a little bit about oxidative stress. And then I was an ordinary sergeant, but kept doing research on the cancer for a long time. And on the way, I found that oxidative stress is very nice target to treat all of many diseases. So today's theme is down the antioxidant therapies. From today, we will have a Yoshikawa International Symposium. And then Professor Yoshikawa is a big name in Japan in oxidative stress research. And then what's the most important work he did is almost 40 years ago, he already mentioned about oxidative stress is cause disease. And then disease itself produces another oxidative stress. That's making your disease more, severe conditions. However, to proving that his theory, it's required a little bit of time. So you already know about the dynamite and the Viagra. As Professor Ferido Murad already have a plenary session, and then his finding NOx is a gas, and then that's making many problems. Especially what he's finding is angina pectoris, shrink of that heart blood vessel is due to via NOx. And then nitroglycerin of dynamite release that NOx from that muscle of vessel, and then artery, coronary artery enlargement, and then the symptoms gone. And then his great job is these signaling was not only by a liquid or electrically, but gas. This is the most important finding of him. However, nitroglycerin is only work for that angina pectoris. And then as a Viagra, this was developed by after his inventions. And then this is only for the malfunctions. problem of pharmaceuticals is only one molecule or enzyme or proteins. That meaning is effect is limited. For example, many pharmaceutical companies try to develop the dementia preventions. However, they spend over 600 billion US dollar and they cannot achieve it because they try to find that one molecule or one protein to cure that all, confused dementia development. And then, as Professor Ferido told you, oxidative stress is coming in a gas, NOx, but you cannot see. And then the gas is immediately change next thing, protein, lipid, many things. To make easy understanding, I would like to show that the two ingredients, one is the hydrogen peroxide. That is a detergent of that crosses, like a Clorox. And then another one is hypochlorous acid, which is now very popular to avoid COVID infections. And then these two products is a final product of oxidative stress. And these two ingredients was made in our bodies. Like a white blood cell will try to find that bacteria or virus. And then, they try to catch them, but cannot destroy. What they use is enzyme and then hydrogen peroxide and hypochlorous acid. These two are, degrade the virus or bacteria. So in that meaning, these final products of oxidative stress protecting us. But you can imagine if you touch to that hydrogen peroxide, that turn to your finger white and inflammation starts. If that in your bodies, these two ingredients level is going up, whole your body is coming to inflammations. So inflammation in the body means that there is an ingredient of bleaching agent. I had developed 20X that is a very simple 8-ingredient supplement. This is not the pharmaceuticals. And then first, I studied alcohol metabolisms, and then glucose and lipid metabolisms, and then oxidative stress reductions. All are were documented and then patented because ingredients are very simple, like here, L-glutamine, vitamin C, L-cysteine, coenzyme Q10, succinic acid, fumaric acid, riboflavin, and niacin. It's very, very popular ingredient. If you go into the drugstore, choose some multivitamin or multi-proteins, you can see that all ingredient. However, the point is this ratio of the mixture. In this ratio of the mixture, that shows a very, very strong antioxidant effect. And then many people thinking if you take some supplement, it is more supplement is effective. And that is wrong, because the antioxidant effect is very limited. And then if you take an overdose of the antioxidant, the effect is going down. So this is the data of human. And then this measurement is hydrogen peroxide level in the serum. So this data was delivered from Wisma, Japan, and they selling the machines to measure hydrogen peroxide. And then you see that's called the DROM test. Below 300 is normal and all are high. But if you take into that 2 or 4 weeks, 20x, very small amount, it's like a 15 milligram per kilo. You can see that, all data going down. So like 30% of oxidative stress is going down. Many doctors try to reduce this parameter using that special amino acid or anti-depression drugs. However, these drugs used for like 6 months, only 7% reduction was found. And then I showed some data of the 20x in my experiments. First one is the diabetes mice. You see that, really fatty. This one is leptin knockout mouse. So they eat a lot. And then this is blood glucose levels. And then you see that the control level is very high, blood glucose. And then after the 5 weeks, a little bit down, but no significant decrease. And then you see that if you use the 20x for in the drinking water, its blood glucose is going down. And at the same time, insulin level is going up. And this is the data from ICDD, from a French company. They're doing a professional service for that oxidative stress measurement. That data shows 20x reducing that mitochondrial ROS is the reactive oxygen species, like 32%. So 45%, and the mitochondrial ROS is 63%. And then interesting is SOD. SOD is superoxide demostase, which attacks oxidative stress that has increased in the mitochondria in 147%. And then this experiment was done at July 2014. And then this company CEO told me 20 is most effective anti-ROS. And then this data show is metabolome. This is the metabolism analysis. You see the green is low metabolism, and the red one is increasing the metabolisms. As you can see, right-hand 3 columns is 20x treatment, is highly increased at the metabolism. It's mainly energy productions. So 20x is very good for your increase your metabolisms. And this slide show a brain of mice and then neurogenesis nerves in hippocampal dentate glyphs. That is a newborn neuron cells. In the young mice, like 6 weeks, show that almost 30 newborn cells in the one viewing area. But after the 56 weeks, that reduced to that to observe, like 60%, because that the aging is reducing your new neuron bonds. And however, in the mouse, giving for like 60 weeks or 20x in the drinking water, they keep that neurogenesis level as young age. And then this is publication in Journal of Alzheimer's Disease. clinical benefits of antioxidative supplement 20X for mild cognitive impairment. And then this study is multi-center, randomized, double-blind, and placebo-controlled prospective intervention study. This is the most difficult experiment in the clinical studies. And then data shows left-hand side column is MMC. This is a measurement of the scoring of dementia. And then 20X improved after 6 months dementia levels. Another thing is Hasegawa score is also same, and the 20X improved. And then this is the first data supplement or pharmaceuticals improve the dementia level and the preventing. Next, I a little bit talk about that cancer things because I'm a cancer researcher. And this is a lung of nude mice. And then you can see that the dot is metastasis of human cancer cell line. And because nude mice can able to implant human cancer cells. And you see left hand big lung shows a huge weight because the mouse weight is 20 grams and then the lung weight is 1.33 grams. And the right-hand side is 20X administrated mice, and the lung weight is 0.36. That meaning is cancer metastasis to the lung was dramatically decreased. So, and then these mice, I checked that the oxidative stress level, this is hydrogen peroxide. Normal is the blue line. Normal mice is like 110 of DROMS test. And then cancer metastasis jumping up at almost double, over 200. So it's a huge oxidative stress. Cancer cells produce oxidative stress because they want to survive. To producing that oxidative stress, that damage our immune systems. So that the immune cells damaged cannot attack the cancer cells. So the 20X group shows a significantly lower level of that hydrogen peroxide. And then we measure the natural killer activity. Natural killer cell is main attacker to the cancer cells. And as you see, normal blue line is like cytotoxicity activity is 36.7%, something like that. But the cancer metastasis was reduced like 62. That meaning is this natural killer activity was damaged by oxidative stress. However, this mouse taking at the 20X and the activity is jumping up more than the normal. That meaning is our immune activity is really reflected by oxidative stress. And then autophagy. As you know, that autophagy is a cleaning system in our bodies. So if in your brains, amyloid beta or tau protein is accumulate in the dementia. One of the reasons is autophagy is not well working. And then this data is diabetes mouse. Normal mouse shows very, strong band, but in the diabetes mouse, no band shows. And then I gave to the diabetes mouse 20X, and you can see that still a little bit of band remains. So it meaning is autophagy in the diabetes is totally damaged. However, 20X protects the autophagy effects. And then one of the life related thing is telomere. So that we have a telomere, and if it's going to be shortening, your life is short. And then most damage is coming from that oxidative stress. This is also a diabetes mouse, and then telomere was measured, and just the normal, no treated diabetes have a lower telomere, but the 20X administration had significantly increasing that telomere longs. That meaning is, even in diabetes, you can prolong that telomere using that antioxidant. And then maybe you remember that Professor Ferido shows that many disease and then the phenomenon in our bodies. He put in it asthma because NOx, oxidative stress, is big trigger of that asthma attacks. And then this data shows monitoring questionnaires. And then asthma patient was administered 4 months 20X. As you see that the left-hand side graph, red one is over 11 times attacks, 10 times, 9, 8, so that half of the patient is more than 6 times, okay? But after starting at the 4 months of 20X, you see that dramatically attack number was decreased. This is because trigger of that asthma attack is conducted by NOx. So reducing that oxidative stress is asthma patient has no attack. So it is very, asthma patient was very happy with the 20X. So this last thing is COVID things. And then this is publication from 2020. And you see that the red circle is ROS, reactive oxygen species. That means oxidative stress. And then corona, COVID-19 infection have many, many symptoms, not only pneumonia, okay? Some heart inflammations, and then embolism, stroke, and many, many, many. As usually, virus infection is not to cause such various symptoms. What the COVID-19 produce is, once infected to the lung, they start producing lots of oxidative stress. And then oxidative stress damaged on our immune systems, and then damage on the vessel inner cells. And then that causes clottings, okay? And this publication was this year's, and I gave to a messenger RNA vaccine side effect patient, and then get the monitors. And I monitored that the fatigue, breathing difficulty, chest pain, smell and taste disorders, headache, brain fog, joint pain, and dizziness. And as you see, that all parameter, this is a higher score patient, and this is graded 6th grade, 0 to 5, and then all symptom was going down after 1 month of taking 20X. So that meaning is vaccine side effect is same as the COVID infections, and then reduced by 20x. And then this is a same this is the same concept. And then antioxidant composition 10x may improve long COVID symptoms. Now it's COVID itself is going to non-toxic mutations. But many people suffer in the long COVID. This is also same parameters: fatigue, breathing difficulty, chest pain, smell and taste disorders, headache, brain fog, joint pain, and dizziness. And then as you see that all parameter is significantly reduced. So, so COVID infection and then the vaccine side effect is all oxidative stress disease. So conclusions, oxidative stress causes many disorders, and antioxidant therapies are effective for almost all disorders. Now, antioxidant therapy is just started. Thank you very much.
Thank you, Professor Haruhiko, for this resume of antioxidant research. So basically, this is a down of the age of antioxidant treatment and therapy, which is so promising today. And what is good about it is not just an individual treatment for a specific disease. It is a treatment that cuts through all diseases and influences the all diseases. So we have a specific symposium exactly on this, full 3 days, actually more, in 2 different rooms. And what we've done this time, we have done some switching between different sessions. Medicine is within antioxidative stress, and COVID is within sessions in order to increase the synergy, but also to give people the timing to present and follow through Zoom. So again, thank you very much, and I invite everybody to attend this very successful symposium that will be coming after the plenary session. Thank you again.